All right, folks, welcome to the last video of chapter 8, which we get into the disorder of joints. So we said that when it came to joints, the more stable, the less mobile. The more mobile, the less stable, right? And so we had different things in synovial joints that are more movable, that they had a lot of different unique characteristics, like the synovial cavity, et cetera, that can help with stability. But no matter what, overall, joints are still going to be easily damaged by injury, inflammation, and degeneration. So let's think of some common injuries. First is going to be cartilage tears. Well, we saw that we had cartilaginous joints, so cartilage tears can be very big there. And that means that if that happens, you can have fragments that may lock the joint itself, or you definitely will have poor healing because there's not a lot of nutrients coming straight to the cartilage because of how it's made, right? It's specialized connective tissue. Also, you can have sprains, which is just your ligaments that can be stretched and torn. So if your ligaments, which again are a band of connective tissue that allows bone to connect to bone, they're torn or stretched or overly stretched, then you definitely can have a lot of slow repair because you have poor blood supply going to that connective tissue as well. And if they completely tear, then they might have to be sewn or grafted, or you just might not be able to use that particular area of your body. You can also have dislocations, also called luxations, where the bone is forced out of alignment. So this can happen with sprains, inflammation, if you fall or you're in some kind of sport, and you can definitely have dislocations. And when that happens, the dislocation must be reduced. And that just simply means that you got to put it back into normal alignment. So just put back into normal alignment. That's what must be reduced means. Now, subluxation is going to be partial dislocation. I've seen folks who had partially dislocated areas that just kept on moving around and walking around until it got worse and worse and worse because they're like, I can take the pain, right? But you want to make sure that you get it put back properly. Otherwise, it's just going to cause things to be more horrible later on. Okay. Now, when we're thinking of some disorder of joints, we're only going to focus on 5 disorders. And when we're talking about these disorders, there's 3 pieces we're going to focus on. We're going to focus on etiology, or really the origin of that particular disorder. We're going to focus on the signs of that disorder and also the symptoms that come from those signs of the disorder. Okay, folks? And the first one that we're going to talk about is scoliosis. Now, we've seen scoliosis before, especially talking about the skeletal system. Well, let's get the etiology of it. This is going to be from, you can have it from at birth, congenital vertebral defects, neuromuscular weakness, meaning that you have muscle weakness around your actual nerve areas, again, causing you to have a misshapen area, or degenerative changes. So as you age, you could end up forming scoliosis depending on how your cartilage is moving, how your spine is joined. We don't know what the overall person's body changes will be, their weight, et cetera, et cetera. Now, when you're looking at all this, it's just a lot of talk here. Your goal is not to be like, I remember every single piece of the etiology of scoliosis or every sign and symptom. Your goal is to just choose 1 or 2. You know what I mean? Etiology, I'm like, okay, adult degenerative changes, or it happens it's congenital, so it happens at birth, right? Also, you can think of signs. Some signs will be your shoulder and hip are asymmetrical, your rib hump on the forward bend, so you see a rib hump on the forward bend here, and your trunk of your overall body is going to shift as well. So just choose one of those. Shoulder, hip, asymmetry. There you go. Symptoms. Usually going to be asymptomatic in adolescence. Of course, as you go older, the symptoms will become more painful. Some folks would have a lot of back pain, fatigue, and also radicular pain. Radicular pain just means any pain that's caused by like a nerve root, because if you are changing and moving your vertebrae and in between your joints, then you could have a lot of compression on those nerve roots, which can cause irritation, okay? And that compression will cause pain as well. You can also have severe curves, and we know that if you have severe curves and it's like in the thoracic region, and guess what? You're going to have lung issues because the thoracic region is connected to the ribs, which help the lungs be able to breathe in and out and expand, or of course, decompress. Some other disorders would be like a sprain. The origin of a sprain would be sudden twisting, or inversion and eversion like we saw before, or overstretching of a ligament. The science for this is pretty easy because I think everyone potentially could have seen someone with a sprained ankle or already obviously experienced a sprained ankle as well. So you will have swelling, bruising, tenderness, decreased range of motion, some unstable joints, and sometimes you'll even hear a pop. Okay, so what are the symptoms? Pain when you move, pain when you try to put weight on your actual foot, difficulty walking. Of course, you can have ankle and knee sprains that you end up having to get bandaged, and some folks even have it to where it's so harmful that they end up having to have crutches, for example. Another disorder is herniated disc. So that means you can have disc degeneration, You can have flexion and rotation that's kind of repetitive that causes the disc to be out of place and of course compressed. And also heavy lifting can cause a herniated disc. So what are the signs? Positive straight leg raise. What does that mean? That means that when you are lying on your back or your leg is straight and you're standing up, you actually have a lot of pain. That could be a symptom of a herniated disc or a sign of a herniated disc. Dermathermal sensory loss. What that means is you're going to have, numbness and tingling. And then also you have a myotomal weakness, which means that whatever muscles around that area of nerve is probably going to get weak as well. And then a decrease in reflexes because of the fact that you are compressing that nerve. Some symptoms: back and neck pain with radiating limb pain. Okay, so it's going to radiate down your limbs as well. Numbness, tingling, weakness. It's going to worsen when sitting, worsen when you're dealing with flexion, you're trying to bend, or even coughing. And so one thing we can see here is sciatica. And sciatica is a nightmare. Okay, sciatica is the worst. Even when you're coughing, you're breathing, you just cannot get through. And sometimes you would have to go either get injections from an anesthesiologist so that you can basically get rid of pain in that area, or some folks even go and do surgery where they fuse bones to get rid of that herniated disc pain. Now here's an example of a herniated disc. We have our fibrocartilage that are surrounding it, and then we have a gel-like center. So what happens when you're dealing with a herniated disc is that gel-like center gets forced out. Basically, the ring of the fibrocartilage ring is going to tear. The gel-like center gets pushed out, and then that's going to hit that nerve and compress it, okay, or irritate it. And that's where that pain comes from. And of course, because these are nerves, we're talking about bundles of nerves of the peripheral nervous system. These are nerve bundles, and so that's the reason why they can radiate down to other parts. In severe cases, then you can have basically that bundle of nerves of the lower spine called the cauda equina signs, and that can even cause issues with numbness and tingling or even loss of bladder sensation. So you can't even feel when you're peeing. You can't even feel it in your genital area sometimes because of the severe case of that herniated disc. Get to our last piece of this video, which is going to be osteoarthritis and rheumatoid arthritis. So the etiology for osteoarthritis means it's probably just going to be a lot of wear and tear. It has to do with age, or if you have some kind of prior joint injury. Obesity, of course, can cause a lot more wear and tear because, again, you have this is the load-bearing areas, so bearing weight, and the more weight can cause a lot of issues where maybe the synovial fluid can't really deal with that extra compression, and so therefore you can also have osteoarthritis. It also is a genetic condition. Both osteoarthritis and rheumatoid can also be genetic. Okay? So again, your goal is to find one or two examples that hit with you when it comes to these disorders so that you can remember these details. What are some of the signs? First, you're going to have a decreased range of motion. You're going to have your joints that are malaligned, so out of place. You also can have bony enlargement. So we see here, we have our good old articular cartilage in a healthy person. We have our meniscus, we have our synovial cavities, and then we have our just a normal joint space, right? But with osteoarthritis, you start getting these bone spurs that are a part of it as well because you're losing cartilage and that joint space starts to narrow. And guess what? More narrowing, less cartilage, less joint space. You're going to start having them grind onto one another, and that can cause a lot of pain. Okay? So that joint pain can worsen with use and eases with rest. So sometimes if you don't just use them, then of course that will lower the pain itself. But you could have situations where because there's not that synovial fluid, you don't have any cartilage, so it's not that smooth movement, you can have about less than 30 minutes of stiffness in the morning as well. You can have a lot of swelling as well. So just keep that in mind. Okay, folks? It's not going to be the same as you would have it where you have that good old synovial fluid that's going to nourish the cartilage, and the cartilage is not broken down, and you have the ability to again compress it, and the synovial fluid gets forced out and helps with all of that extra shock absorbance. All that's gone when it comes to osteoarthritis. Okay, well, osteoarthritis, osteo means bone, is coming from wear and tear, usually age-related. Rheumatoid arthritis is autoimmune and synovitis. So synovitis means inflammation of the synovial membrane. So it's an autoimmune issue that's coming from causing inflammation of the synovial membrane. This usually happens a lot with women, typically between 40 and 60. It's going to happen more in women than men. And there's definitely a genetic and also can be environmental factors that can cause issues with epigenetics, meaning things from your environment that can also change your genes. And that's something like smoking. Okay. Some signs of rheumatoid arthritis is going to be small joint swellings or tenderness, decreased range of motion for sure. And it can even get so chronic that you have deformities. okay, in your actual hands or wherever you have that rheumatoid arthritis. So you can actually see that this is a normal hand here with normal joints. Again, you see that synovial cavity. Whereas when you have rheumatoid arthritis, that synovial cavity is super inflamed. And because of that, it can cause a lot of swelling and tenderness. And as you can see, we have a difference in shape of the hand. And that's what we mean by deformities of it, okay? Now, one of the main symptoms you're going to see is stiffness. And this could be more than an hour of stiffness. And at some point, by the time a person has just very, very chronic rheumatoid arthritis, then they get so stiff they can't even move on their own anymore. Okay, their joints are completely immobile, and it's also very painful. So just keep that in mind. You can have those deformities that kind of just keep your hands locked into place. Okay, you can have very painful flare-ups, and also you're going to have fatigue, you're going to have low-grade fever, you're probably going to have weight loss, because again, this is all connected to your body itself, and it's autoimmune. So all that extra inflammation can cause fever, weight loss, and fatigue. And of course, if you're not getting the proper help and you have rheumatoid arthritis, then you also will have can have difficulty eating, especially if it's in your hands. Okay, because you might be like, oh, I can still kind of move the joints, like the elbow joint, for example, to move food up to me, but I won't be able to move my fingers for grasping or anything like that to bring the food to my mouth. Okay, but then you can have situations where your hands are kind of immobile and almost like stone, and then your arms are also like stone, so you have to have other help from other people to make sure that you are getting the nutrients you need. Okay, so all that swelling, producing excess fluid, you might be thinking, producing excess fluid, well, shouldn't that really help the joint? No. You might be asking, well, why? Well, remember, synovial fluid that's coming from the synovial cavity is going to be thick, viscous. Okay, it's going to help with smooth movement. It's going to help be in the shock absorber. Where when you're talking about the extra synovial fluid that is a part of inflammation when it comes to rheumatoid arthritis, it's very thin. So it's not really going to help with the overall joint itself and keeping it, lubricated properly or anything like that. And because you have this extra thin fluid, that can actually raise pressure in those areas. That helps break down the cartilage as well. And so it kind of hurts the joint versus lubricating it and causing it to be a shock absorber. Okay, folks? So again, choose one to two pieces of etiology, signs, and symptoms for all the different 5 disorders we saw, just to help yourself remember these details. For example, if you're remembering rheumatoid arthritis and the sign of it, you can say rheumatoid nodules. And these nodules are just these firm, kind of not really tender lumps of inflamed tissue that's going to basically form under the skin and usually over where the pressure points are for those joints. Okay? And this can also happen in other areas as well, which is why rheumatoid arthritis can get worse and worse and worse over time. All right, folks, so that ends our conversation of Chapter 8. And I'll see you when we start talking about Chapter 9, muscle inflammation, immune system. Bye-bye.